In a span of just 72 hours, more than 150 cases of people infected with a newly discovered coronavirus have been reported in China. That takes the number of cases in the country to more than 200, with 3 fatalities so far. The country's National Health Commission, however, says the outbreak is, quote, preventable and controllable. Scientists have so far said human-to-human transmission of the virus does not appear to be easy. The outbreak began late in December and was traced to a seafood market in the central city of Wuhan. Since then, cases have been confirmed in South Korea, Japan, and Thailand. Airports in the region and some in the US have already established screening procedures for flights coming from central China, measures that look set to be increasingly important as travel picks up ahead of Lunar New Year that falls on the weekend.
Every year, around this time, hundreds of millions in China will move around cities ahead of the Lunar New Year. Heavily packed, these Chinese rural workers are ready to return home. The current outbreak of the mysterious virus isn't stopping them.
I haven't seen my son for so long. Let's stop thinking about the virus.
The infection is said to be a new type of coronavirus which causes respiratory symptoms. This fish market in the city of Wuhan might be its origin. Nearly 200 cases have so far been confirmed in the city alone. After cases were also confirmed in Thailand, Japan, and South Korea, authorities around the globe have stepped up screening of travelers from Wuhan. Chinese health officials say the virus is not very contagious, but have not ruled out limited human-to-human transmission.
We have learned that the clinical symptoms of the known patients are generally mild. With the effective measures put in place, we can prevent and control the disease from spreading.
Despite the attempt to calm people's nerves, some are worried that Beijing might be downplaying the epidemic. The virus is similar to SARS, which killed hundreds in 2002 and 2003. And with a lot still unknown about the new virus, the New Year's rush is putting many on high alert.
Joining me now from Geneva is World Health Organization spokesperson Tarik Yasharevich. Mr. Yasharevich, welcome. 139 new cases in 48 hours. Is there cause for alarm?
Well, we know that the number of confirmed cases is increasing simply because Chinese authorities are reinforcing surveillance and are testing more people. It is likely that we will see further increase in cases inside China, and we can also see more cases among travelers. So this is something in line of what we were asking countries to get ready for this new coronavirus, to be aware of it and to increase really surveillance, as well as being able to treat those who need medical care. What is really important to say is that we still don't know much about this virus. So we don't have enough of information to determine what is the source of the virus. We know that there is a limited human-to-human transmission, but we don't know how easily is being transmitted this new coronavirus. We also don't know much about severity of it. So this is something that is being looked at right now, and I think it's a positive thing that China were able to quickly identify this virus, that country was sharing genetic sequence of this virus that helped other countries develop diagnostics. But again, this is something very new, and we need to understand better.
You talked about people traveling. Millions will be traveling in this week ahead of Lunar New Year. Should there be cause of concern amongst them?
Well, every new virus is obviously a legitimate concern for population as well as for the health community. At this point in time, WHO is not advising for any travel restriction. I think Chinese authorities are gearing up the surveillance. We also provided to all countries, including China, a set of guidance on how to monitor for new cases, how to treat sick people, how to develop diagnostics, how to inform the population. And obviously, for the population, it is important to follow general rules of precaution when it comes to respiratory diseases, hand washing, avoiding contact with visibly sick people, covering mouth when sneezing, avoiding contact with live animals at markets, and these sort of things.
Tarek Yasharevich, spokesperson for the World Health Organization. Thank you so much for your time.
Thank you.